there's two parts to your tummy tuck. One is there's extra skin, and you're removing that, tightening the tissues. And the other is tightening the muscle, because you have two muscles down the center of your abdomen, and there's space in between. And if you've gained a lot of weight, you gain weight on the inside that pushes those muscles apart, just like pregnancy does. And the tissue in between it doesn't have contractile fibers like a muscle. So you can do all the sit-ups in the world and make the muscle shorter and tighter, but you're not doing anything to the tissue in between. So it can allow the muscles to come apart. And that's part of the problem that women have after they've had several pregnancies, is they can do sit-ups, but it doesn't quite flatten their tummy. So what we do, some people have almost no extra skin, but their muscles are just, especially women that have had twins, their muscles have just been pulled apart so far. And so you do, just usually some of both. And even if women are really exercising a lot and their muscles are tight, I go, we're going to have this all exposed. This is the only time in your life that's going to happen. Why don't we just pull those muscles back together, and it'll be done for the rest of your life. So it'll always be fixed. So it's a combination of each, that we're tightening the skin or muscles and the skin both. Liposuction, for instance, will remove fat, but it won't tighten the skin and the muscle. And often the two go together, and you have to address the whole situation. If the flap or the abdominal wall is really thick with fat, you may not be able to pull down very much and get much of a result, because it's really the thickness this way, not the excess this way. And even tightening the muscle isn't going to show that much. So then you need to think about maybe doing lipo also. And often you need to address the whole trunk, and not just doing the skin, but doing fat. Or the skin may go all the way around or part way around. You need to address the whole trunk, and you need to add what the patient has to address the whole contour of their body.
When you talk about tummy tucks, basically what you're talking about are two things. You are talking about patients who have extra skin and fat, usually extra skin from either pregnancy or weight loss, or just genetics. And then you're also talking about the muscles on the inside of the fat layer, and we tighten that muscle, because during pregnancy the muscles separate. And so what we do is that we bring them together and tighten them. And that's sort of like wearing a girdle on the inside. So patients tend to lose weight after they have a tummy tuck. And it's not uncommon for somebody to drop another 10 or 15 pounds after their surgery, which they like. So that's a procedure with about a 10-day recovery. It's an incision that's low in the abdomen, usually hidden very well by underwear and bikinis and things like that. And patients who haven't worn a bikini for years and years and years may find themselves going bathing suit shopping and being very happy. Tummy tuck is probably the longest recovery, because we're tightening the muscle and tightening the skin, and we're making everybody very, very tight. So I tell patients 10 days to 2 weeks to take off from work if you're going to do a tummy tuck. Now, a lot of people combine procedures. They'll say, well, I breastfed 4 children, and my tummy is sagging and my breasts are sagging, so we'll do both surgeries together. In that case, usually the recovery time is about 2 weeks as well. So the tummy tuck determines how long the recovery is going to be. We are also using a new drug, relatively new drug. We've been using it for about 2 years. It's called Exparel, and it's a long acting local anesthetic that we inject around the abdomen inside, and it really helps with the pain for the first 3 days. So it lets the patient get up, get around, and have an easier early recovery.
Recovery time for a tummy tuck depends on which part of the recovery you're talking about, because this recovery is definitely in stages, speaking from personal experience. The initial recovery period, you're going to be not moving a whole lot for a few days. We nowadays have a combination of medications that we give. One is that we inject in the covering, under the covering of the muscle at the time of surgery, that lasts for several days, that decreases the pain and decreases the need for narcotics in the first few days, which really has helped. And the other is a pill that we give before surgery. And the combination has seemed to reduce the discomfort remarkably. Most patients, they're up the next day. We need them to be up and walking, but they're fairly comfortable. For the first week, you're pretty quiet, but you're up and walking around. I'd say by 2 weeks, they're getting around pretty well and starting to walk straight up. But I've noticed myself and with my patients, it's probably 6 to 8 weeks before they're really getting their energy back. But I tell them it's going to be 8 or 9 months before the swelling is gone. They don't feel little twinges now and again. It's going to be 1.5 to 2 years before their scars are fully mature and turned white and flat, and at least that long before they get all the sensation back in their tummy. So it's a long total recovery, but within a few weeks they're back doing most of their activities. So it's a long process, and I often tell them you're going to have to be patient. You can't be looking in the mirror 3 or 4 weeks later and thinking that you should be healed and over with, or that you're back to most of your activities and you should be over this. It's not like that. If you get past that, the time goes by quickly, and before you know it, it's over, and you've got the rest of your life to enjoy this fabulous result.